We're back.
We're back.
So what are we going to do now?
We're going to talk about the Powerpack Healing.
Yeah.
And how we...
Oh my God, do you know what you just did?
What did I just do?
You just brought me back to that game show host, Alana White.
It is though.
Okay, all right, okay.
How we take 25,000 volts of electricity and put it into your body and jumpstart your mitochondria.
No, I liked it. I liked her too, just
Okay,
know that.
perfect.
Okay, so I wasn't trying to make fun of you, okay? Just know that.
It's funny, I've heard that before.
Really?
Yeah.
Well, how beautiful is that? Okay, so, and don't tell me what I look like or act like, because I don't need to know. Okay, now, so yeah, 25,000 volts. You do know there's not another device that delivers that in the world. And people are going to tell you, they're going to go, listen, I've got a Rife machine, and I think that's great, but Rife is what? It's an 80-year-old technology, guys. I'm not saying it didn't work. I'm trying to tell you, 25,000 volts is every frequency packed into one. Did you get that? This delivers a rainbow. Does everybody know that when you see the sun and after the rain and you see the rainbow? Well, that is all nutrition from A to Z that you're getting from the sun. You're getting so much nutrition. Now understand something. With a Cellsonic, it has the ability to actually what? Break up calcium stones. Oh, wait a minute. So what do you think it could do to calcium deposits in the breast?
Break them up and allow your body to remove them.
Okay, so when we work on people, now understand this. First, we're going to just take a few minutes and we're going to explain the domino effect of why this is the most powerful device on the planet. And it is. There is nothing that can touch this thing. So here's what happens. The more anxiety, the more stress, the more moody you are, the more depressed you are, the more angry you are, the more you dump the hack. What's the hack?
Histamine, adrenaline, and cortisol, and they all acidify your blood terrain. So now your body has to actually pull calcium from your bones to buffer down that acidity that most of us are creating on a minute-to-minute basis.
So here's the deal. When she said your blood, so that means all the blood in your arteries, okay? When you go and you do the little freak out, and guess what? Oh, this is my personality. Please. Okay. But when you do the freak out, remember you're dumping histamine, adrenaline, and cortisol. That spells hack. And when you do it, don't you find you cough? Because your body's trying to cough it up, trying to get rid of that hairball of anger, that hairball of depression, that hairball, okay? That's emotional issues in the tissues, hate, whatever it is. Now, did you know that if your blood pH just drops slightly and you can't pull on the calcium to get it into your blood, you'll go into a coma? Did you know if it drops slightly more than that, you will die? So what would you rather have? That you perish? Or would you rather have that you're pulling the calcium from the arterial walls and you're pulling the calcium from the closest bones to that area? What would you rather? Why do you think osteoporosis is such a big deal? Why do you think arthritis is such a big deal? Why do you think stage 4 inflammation is such a big deal? It's happening more and more. The last 3 years, okay, have been highly stressful for most people that bought into the story. Bought into his story. Okay? So understand, think about every time that you heard something that pissed you off, you heard something that got you angry, you heard something that depressed you, something that caused you anxiety, a headache, caused you acid reflux, anything like that. You were dumping adrenaline, histamine, and cortisol. Now remember something. The human body, right? Oh, you're going to love this. 50 years ago, we used to dump histamine, adrenaline, and cortisol like a heavy dump 3 times a month.
Because you'd be being chased by a big toothy animal.
Or there would be a trauma in the family. Now, because we've got the government, we've got the medical system, we got the media. They understood something. And I'm not talking about doctors and nurses. I'm not picking on anybody. I'm not picking on the people that work in the government. These are all just entities. But these entities are corporations, and they realized that the more anxiety they could create, the more acid you dumped, the more calcium you pulled from your bones, the more that the acid would make your beautiful connective tissue, your tendons, your ligaments, your organs, your brain tissue, and would cause scar tissue. In the brain, it's called what? Lesions. In the gut, it's called adhesions. In the joint, it's called arthritis. In the pancreas, it's called diabetes. And guess what? The biggest disease that we're going to see over the next 10 years is diabetes. That's the next biggest one. That is the biggest one. Now, even the heart doesn't get cancer, but the heart will get scar tissue and it will get calcium. How many people know that when you have to have a stent put in, you just calcified the valve in your heart? You pulled in so much calcium in there because of what? Not because of the diet. The heart's so high vibrational, you actually pulled the calcium into your heart because your heart was broken. My heart is broken. My heart's in pieces. My heart is empty. The heart is the emotional organ of the human body. It collects all your love stories. And most of those love stories are not love stories, are they? They're horror love stories. And so the more that you hurt from with your family not loving you, or a love affair, or a relationship, okay, the more you damage your heart. Let me tell you something. Why don't believe me? Then why are we've got people that eat 10 times worse than you and they don't have heart disease? Because it is an emotional organ. And understand this. We also know that diseases are not genetic. There is none that are genetic. They're all epigenetic. Okay? All right? Bruce Lipton, check his work. Check out. There's so many people that you could check out and understand. Medical system is never going to give up the genetic story, even though they did what was called the Genome Project and it was a complete fail. If they did that, they'd have to give up their whole system of working. So I'm not blaming doctors, nurses, nobody. I'm trying to tell you the medical system's not broken. It's doing exactly what it should. All these systems that you go, the system's broken, we need to repair it. You're not going to repair these systems. Mind your own business.
You need to remove yourself from that system.
So here's the deal, and you can believe it or not believe it. I've been doing this for 40 years. 40 years, and I can prove it. We offer a money-back guarantee on our first treatment to everybody that walks into our clinic, that it will not be better than all the rest, but it will outdo everything combined. Did you get that? I mean it. The reality is if you're not doing a body work or a treatment or a technique that is pulling the beef jerky apart. Look at, we're going to get into the Celsonic here, but you've got to understand, you guys all need to understand this, because this is the holy grail of healing, whether people like it or not, or whether they feel threatened by me or not, it doesn't matter. Do you know why Grandpa walks stiff as a board? Because he's so calcified and full of scar tissue. Do you want to know why you've got arthritis? Arthritis means what? Inflammation of the joint. And the longer you have inflammation in the joint, and the joint's like a river, so you're going to have the garbage collect in the bend in the river. But wherever you have pain, you have inflammation. Wherever you have inflammation, you're going to be sending calcium there to try to buffer down so that you don't have the mutation. You need to stay alkaline because you're too acidic when you're inflamed. So you're going to pull the calcium from the bones closest to it. Any woman that has calcifications in her breast, she has osteoporosis in her ribs and in her clavicle and in her neck. Did you know that? Okay, any place that if you've got prostate problems and you've got stage 1, 2, 3, or 4, or you've got or any ovarian problems that are stage 4 inflammation, or you've got where they say you need hip surgery because you're bone on bone. You're not bone on bone. You're calcified. Even the cartilage and all of the tissues get calcified. And remember, inflammation. What's the first? There's always a clue, guys. Okay, so these psychos have to leave you clues. And that is universal law. you need to leave clues, and if people don't pick up on them, that's too damn bad. You can tell them we're coming for you, and they can come hard, and if you don't want to listen, then too bad. It's universal law. There's no one coming to save you. You get this? So now, so understand. So we know that if we get inflamed, we're going to send calcium to the area to buffer down that area and alkaline the area, because we don't want what? Well, we go from inflammation, which is inflame, which means we're heating up, right? And guess what? When you add a fire to anything, do you create dehydration? So what is actually all of these diseases is dehydration of the tissues from inflammation, and then the calcification comes into the scar tissues, and now you've got a mass. You will never have swelling, stiffness, inflammation, okay, or pain if you don't have a blockage in your body. And that's why tomorrow we're going to be doing clapping, and we're going to prove it. And if everybody were to buy a clapper, even start clapping those areas, do you have anything you want to say right now?
Yeah, that when you clap, you actually will, it is the best self-diagnose tool you can use as far as finding where you have stagnation within your circulation. If there is pain there and you clap it, you're going to find out, and you will restore the microcirculation in that tissue, which is so important because it is 74% of your circulatory system. So it is so powerful.
When we first started teaching clapping, we'd have natural health practitioners telling their patients, when they would go to their patients, that you need to sue Dr. Wolf. That's why I have to get ahead of everything I do. And that's why I've got all these videos, and it's proven. Healthy people don't bruise. If you don't believe me, then you know what? Have you ever had someone come and say, I never bumped into anything and I got a bruise? Well, that person is rotting out.
Your tissue's overripe.
And if you could go to where that bruise is and open it up and smell it, you would smell rotting tissue. And the reality is this: when you clap, the more purple it becomes, the more blacker it becomes, the more swelling, and the more it flows down your arm or runs up your arm. That's how much infection you have in there. And those issues in your tissues were emotional before. Let's swing back to what we were talking about though. Tomorrow we'll go into that, because it's all about circulation. If you had perfect circulation, what would you have?
Perfect health.
You'd have perfect health. And that's why we try to get as many cell-sonic and cardio beds into every clinic as possible. Because understand, they will do miracles with every patient. And guess what? And then we become the ultimate threat. And we're not threatening anyone. But the reality is everything that we were told that was irreversible is reversible.
The cell-sonic is the catalyst for healing.
The cell-sonic, it comes in at 25,000 volts, and it comes as a field. You couldn't take 25,000 volts. I couldn't put my finger into a socket here, okay? And that is a lot less than 25,000 volts, and think I'm going to live from it, because I'm not. But the reality is when you take 25,000 volts and you bring it through a liquid medium and you put it into a field, you are getting 25,000 volts, but not the physical way that you think. And remember something, it's all about your field. You will find that this week we'll be talking about protecting your field, and everything is about electricity. Okay, let me ask you a question. Somebody who has no electricity in their body, how well are they?
They're dead.
So somebody that has very little electricity in their body, how well are they? They're very sick. They can't get out of bed. You give me a sick person, and you know why they're sick, don't you? They had sick beliefs that were programmed into them. And how many people can actually get out of bed and walk, but they'll get out of bed to get in a wheelchair? They'll get in the wheelchair, get from the wheelchair, get back into bed, but they won't get up and walk because they were emotionally crippled before they were ever physically crippled. And that's every one of you. Every one of your so-called diseases started off as a loving little message from your body saying, why can't you love me? Why can't you align yourself? Why can't you unconditionally care for me? Because you don't know how. Tell me you know how. We've got a ton of practitioners in here. Why are you taking this course? You wouldn't take the course if you knew how. And I'm not telling you that anybody, no, there's no stupid people out there. We've been programmed. We are feeding corporations and we need to stop. That's all. That's my political for this afternoon. It's over. Listen, so what we got to do, so calcification. So this wall right here, do you think that I could take this cement wall and massage it and get rid of it? Look at all the therapies out there that are trying to get rid of cement. You do know that when you pull calcium from your body and you put it in your tissues, you put it in your organs, tendons and ligaments, okay, and you put it in your joints, it's called cement. You're cementing. So how many people here know that old age is you cementing your tissues, your organs, your ligaments, your joints, and frying like a burger on a burner and just leaving it there until it becomes beef jerky. Now look at, when we work on you and do the cell-sonic, we are going to usually do the cell-sonic before or after, or we might have to do the cell-sonic before and after. But how would you like it if you could go somewhere and have to do 20 treatments, and I could outdo that 20 treatments way beyond Thunderdome in one non-surgical and one cell-sonic? Okay, why are people flying from all over the world? Why are people coming from all over the world? You see it, don't you?
I see it.
Yeah, and you're gonna believe it when we go through this. But here's the deal. So now, you've got beautiful connective tissue, you've got beautiful organs, beautiful tendons, beautiful ligaments, and guess what? Your spirit is going through all of it. It's flowing through. Your blood is flowing through. Your lymph is flowing through. You're in the flow, baby. Okay? Now guess what? Let's stress out and let's dump adrenaline and cortisol and we'll contract, won't we? What did you just do?
Cut off the flow.
Come on, put your hand like this for 20 minutes and then try to open it. You can hardly even open it. Now leave it like that for 3 months. How about leave it like that for 3 years like they've done to us? They've had some people like this for 3 years. How much oxygen is going in there? How much am I detoxifying? How much can my spirit flow? What are you talking about, spirit, Dale? Well, that's the energy that came from the heavens into the womb that someday will leave your body and go, I don't know where, because I'm not going to pretend I do, but I know that it is eternal.
When you have no energy, you've cut off your spirit. We look at children and go, where does all the energy come from? Well, they're more connected to their spirit when they're young like that until, they get ruled, schooled, and fooled because they go to school for 12 years and they get told to sit down, shut up, and listen.
Yeah, and guess what? You are not going to have a bowel movement or pee until recess.
Yeah.
That is inhuman. But that's another story. What did you do that for? Okay, now.
Well, it was just a point to make.
Yeah. So anyways, what happens is when you contract, you tighten up. When you are in pain, do you go and curl up like in a fetal position? So guess what? When you contract, and you don't even know you're doing it because you're running a program now, because you're a stress monkey, okay? And the world's going to end. Oh, the world's been ending so often, I'm just like over it. Hey, Daryl, the world's going to end. That's good. Thank God. I need a new world.
The sky's falling.
Okay, so now you get all stressed out and you go into a contractual situation. And do you think would you pull your fibers together? Oh, why don't we dump some adrenaline and cortisol? That's like super glue. And guess what? You think I'm kidding? Why do you think you've got boogers in your nose, in your ears, in your vagina, in your bowels? Because you're so inflamed inside, your body's got to make excess mucus. And how many people know that the elderly are dying right now because they are actually, their alveoli, which is supposed to be collecting oxygen, is full of pus. So we'll be going into everything. And understand something, everybody. Just know this, and I need to say it because there might be somebody on here. Take infinite iodine. You can take infinite iodine straight, or you can dilute it down. So infinite iodine, 1 part, and 3 parts distilled water, structured preferably, the distilled water, but it doesn't have to be. You don't want any minerals in there. And you can nebulize that. And then work your way up to just straight iodine, infinite iodine, not the regular iodine, Lugos or Nascent, because did you know we have the only non-toxic iodine in the world? We do. That's a fact. We'll prove it. We've got all the stats to prove it. So now you can nebulize this, and whether you want to believe it or not, with doing cell-sonic, non-surgical, perfect day diet, and our nutraceuticals, with Nebulizing is so important. Even if you don't have any breathing problems, how would you like to never have any? How would you like to nebulize infinite iodine? Or you take silver bullet liquid and you take bright eyes 50-50 and you nebulize those, and the iodine will disinfect in 15 seconds. A virus, bacteria, fungus, okay? The bright eyes, okay, which is the only fulvic you can put in your eyes. Nobody else can make it, because we're the only ones that make humic fulvic without chemicals.
It's superior to any humic fulvic out there.
So now you take the humic and you take you take the bright eyes and you take the silver 50-50 and you nebulize that. Now we know that the silver bullet will actually go in, it's nature's strongest antibiotic. We know that the bright eyes will go in and dump 70 micronutrients into any tissues in a gas, in a vapor, and it will pick up 300 to 600% of its weight in toxic waste. Where's that going? Into your lungs. It's going into your blood. It's going into your brain when you nebulize.
Heavy metals
So
too.
yeah, oh yeah, and you want to, guess what guys, you don't need any heavy metal cleanses. You don't need any virus cleanses. You don't need any parasite cleanses when you're doing the black gold and the black diamond. You're done. You're done. And understand, when you create a perfect day, why would you need to do a deep cleanse?
Just gentle daily
If you had a
cleansing.
perfect day every day, why do you let the crap build up? Oh my God, it's time to do a cleanse. I'm going to do a deep cleanse. Why? Because I feel like crap. Well, why did you let that happen? Think about it. Let's go a little higher here. Let's get back to this. So everything is inflammation, scar tissue formation, calcification. Now, does anybody know that a celsonic, okay, will actually, thank you, honey. Okay, she's not really here. Okay, so anyways, a celsonic will go in, and does anybody know why a baby grows so fast? Because a baby 24/7, every millimeter, there's a fracture happening. So it's a little crack in the bones. And then when the crack in the bones happens, it releases an ion, a calcium ion. And then the calcium ion creates, oh my God, an ion's invisible, and it creates physical calcium to fill back in to the crack. Welcome to the miracle. And we're going to talk about how we can bring back calcium ion therapy back to somebody who doesn't have it anymore. Anybody over 30 doesn't make IGF-1 anymore, doesn't make human growth hormones hardly at all, and doesn't break bone and make bone properly.
They're
and
not
guess what?
doing osteoblasts. They're primarily osteoclasts.
Osteoclast. And guess what? We're able to show you how to do it all as if you're young again. Okay, everybody goes, where does he get his energy from? Well, that's where I get my energy from. Okay, we hacked it. I got all the calcium ions in my body as if I'm a teenager. I've got all the IGF-1 that a 25-year-old would have. And understand, human growth hormone makes IGF-1. And we have a totally natural IGF-1 that we make. And if they did a test, they would say, no, your liver made it. This doesn't look like it was ever made. Your liver must have made it. We're off topic. So now, when you get a celsonic, it will go in and it will create small little fractures in your bones. Not a fracture where I go to the doctor, you'll never know it. And it's creating those ions again. So now, when we go and do an area that is a calcium deposit that shouldn't be there, guess what? It fractures it, and I know you're not going to believe this, the calcium where it was taken from goes back to the same place. And so we also use Merigen, Cardigen, Dentagen. These are all different types of calcium therapies, and we'll use that for somebody who's really calcified, okay? Or somebody who has stage 3 or 4 inflammation, we'll use Merigen, and they'll use it 3 times a day, and we'll use the celsonic non-surgical, we'll do the vaginal infusion, we'll do the ultimate coffee. We will do front-end loading, and we will go in, and we will play catch me up. And do you know what that means? You've all had a visa, right? Mm-hmm. So now let's say I gave you a visa and you didn't make any payments. So guess what? I've made payments for 20 years. They say you can't catch up. Well, yes, you can. So now we're going to go and catch up with all those payments. And then we're going to reverse the aging process of that person. Mm-hmm. And remember something, if I'm not lying and cancer is actually stage 4 inflammation, which wants you to do your homework and prove me wrong. If all you knew is all I have to do is bring the inflammation down in the body, now I don't have to treat cancer, which they call a death disease, right? It's the end of your life as you know it. So let's just change the way we think about things. Do you understand? So now we know that this here will actually, it will put electrical charge back into your tissues.
Jump starts the mitochondria. If you could put a booster pack on it and restore that function, well, you can.
And now we're going to prove it to you. Okay. So let me explain what goes on here. It doesn't matter whether you have arthritis, stage 4 inflammation, Alzheimer's, which is, does anybody know what that is? It's type 3 diabetes. Alzheimer's, type 3 diabetes. Let me just say that right now. Did you ever go to see somebody who's a caretaker for their mom, their dad, or their husband, or their wife? They're still eating toast. They're still having sugar. They're still eating crap. Alzheimer's patients do not get fed properly. They don't go on nutraceuticals. They go on cheap supplements, maybe. They have a caretaker that knows nothing about nutrition. The world, needs a shake-up. Okay, now, let's get back to it. Where was I? Mitochondria. So, your mitochondria are in every cell of the body. Say that back to me. This is really important.
Mitochondria are in every cell of the body.
Please, I'm not treating you like children, but if you get this, and if I say something, you say it. Okay, listen. The mitochondria are the powerhouse of every cell.
The mitochondria are the powerhouse of every cell.
When you eat inflammatory foods or you lose your what? Shit? Okay. When you lose your shit, you calcify your mitochondria. When you and why do you do that? Well, just as, remember what I said? If you get inflamed, you're going to pull calcium to the joint, to the organ, to the tendon, to the muscle, to the brain. Doesn't matter where. And remember, what gets inflamed before anything else? Your brain. How many people know there is no such thing as depression? How many people know that when the brain gets overheated because you've been telling a horror story too long and too strong, and you allowed these buggers to scare you too long, that your brain actually has to shut down like any computer? That's it. I don't know why I'm depressed.
It overheats.
Your brain overheated. Now you need to go to the beach and do a sand scrub and just be a vegetable and meditate. And guess what? You'll be back in a few days. But no, then they put you on antidepressants, and they did a major study. You do know, did anybody hear my videos? They did a major study. They released it 6 months ago. The only side effect of doing antidepressants is suicide. Suicidal thoughts are suicide. So now you know what they're supposed to do legally now? They didn't take them off the market. Mr. Jones, have you been thinking about suicide lately? Well, you know you're not going to say yes, even if you were, because they're going to bring a straitjacket for you. Yeah, I'm not crazy. Okay, so now let's take a look at it. So, just as outside the cell, just as your joint, just as your tendons, muscles, ligaments, organs can get inflamed, just like your brain gets inflamed, guess what? How does it feel to tell the same horrifying story to yourself all the time? It's exhausting. It's exhausting. You feel like you're on fire, and then after that, then you feel like a vegetable. Okay. So, remember, every time that happens, and every time you terrify yourself, how many people know that the outer covering of the cell thickens? You didn't know that? Why? Oh, come on, I thought you all went to school and you got all that schooling. You know, you can't even, a doctor doesn't even know that. And guess what? What happens when you get traumatized? Do you lock down?
The cell can't take anything in
the
or
cell,
let go of it.
When the cell feels traumatized by too much adrenaline, cortisol, and histamines, it will thicken. If you feel stressed and you feel threatened, your cells will actually create a thick layer outside of them. So now are they detoxifying? Are they bringing oxygen in?
They're dysfunctional.
They get, so not enough oxygen, not enough flow in and out, because guess what? What happens with a healthy cell? Does anybody know? Well, let's talk about a healthy cell first, and then we'll talk about a dysfunctional one. Your mitochondria spin 2,500 times per second when healthy. And when they spin 2,500 times per second, they make tons of ATP. Does anybody know how much you make? You make 75 kilos of ATP, an adult. 75 kilos of ATP a day from your cells when you're healthy. Did 75 kilos? That's half your body weight. And that energy is being used. What happens when you make ATP in the cell, it's called a sodium-potassium pump. You know about that anyways, they told you that. But it's used to bring the ATP out of the cell into the extracellular fluid. Do you know what happens when the ATP comes out and it pumps out a bunch? A lightning bolt goes off and it creates a new cell. So now I'm not making ATP anymore. Why? Because guess what? I've been telling trauma stories and stressing out all the time and freaking myself out. And guess what? I've been eating inflammatory foods. I've been eating a good diet like everybody else, right? So between the eating of the inflammatory foods and inflaming myself with these stories, guess what? Now you put your cells on fire. So now we send calcium into the cells, metabolic calcium. It calcifies the mitochondria. Now they spin only 300 to 600 times, not 2,500. And the person that's in bed, their mitochondria is only spinning 200 times.
And they're replicating damaged cells.
That's right. Because guess what? You're not creating enough AT to make these new cells anymore. So here's the deal. That's why people don't get well. But we know how to hack this.
Biohacking.
Yeah, and you know what? First of all, where's the beautiful music that the person used to listen to when they were dancing and they were romancing? Where's the light coming in? Do you understand something? Listen, I wouldn't let any family near me if I was ill. Because they all come in and they pity you like some dying animal. And why? Because nobody knows how to look after you. Because nobody learned in school, and nobody learns on TV, and nobody learns in the newspaper, and definitely nobody learns from their family anything about health. Yes or no?
Yes.
Most health practitioners, even natural ones, don't even know what I just said. And I'm not telling you they're stupid. I'm telling you that we've been screwed over. So now, okay, here we go. So now what happens is, when you do the cell sonic, just one pulse, it decalcified the mitochondria. One pulse. Do you know what they used this for? Do you know what this was first used for when it came out?
Kidney stones.
Kidney stones. Getting rid of kidney stones. And then they found out that it was doing all this. Let me tell you something right now. I'm not going to tell you the stories. We're going to be starting a show called Cell Sonic World, where practitioners are going to come on who have bought a Cell Sonic or bought a Cell Sonic and a cardio med bed. And they're going to be coming on every 2 weeks with their not made up stories. They're going to be coming on with true written testimonials or videos from people that will blow your mind. And when people buy a Cell Sonic, they can buy a Cell Sonic, not from me, from someone else if they want. And they can buy a Cell Sonic for $125,000 US. That's how much it is. But when they buy it through us, what do? We give them the whole course free. The New World Practitioner, the Whole Life Coach, the Wolf Non-Surgical, and the Pelvic course. It's all free. It's all free. Then you go up into our world map. Okay, then you come on the show. Do you understand? And if you bought a Cell Sonic and a cardio med bed, and the cardio med bed is $35,000, and those cardio med beds, new, they sell for $150,000 to $250,000. We'll talk a little bit about that, but we're talking about the Cell Sonic today, and we're going to talk about the people that want Cell Sonic and what condition you're in and what body part and how we're going to do it. That's why we're here. So do you understand that everything is electrical? You understand that, guess what? You are an energy medicine device. You are an electrical magnetic light energy being. So everything is about bringing light in and high vibrational electricity. That's why you can't stop eating until you bring in the right frequency to turn off either your anxiety or to turn off your hunger. Do you get that? So understand, even though the cell will get thick on the outside from you stressing out, just know, guess what? You've all been sucker punched. I'm telling you right now, nobody will ever scare me or make me feel any fear again. And I am fearless. And do you know why I'm fearless? Because guess what? There is no world crisis. Every world crisis is a fraud.
I was going to say, every world crisis I can think of from the time I was old enough to start paying attention, they've all been nothing. Like
They're nothing.
Big one was Y2K. The computers are all going to shut down.
I'm going to say this right now, that I want somebody to come on and call me 469-861-9454 and prove one time in the world that it was a true world crisis, and I'm telling you, you made it up. And then I'm going to tell you to go and I'll show you where to do some research that you don't know what you're talking about.
It's all false evidence appearing real.
That's all. And the reality is this: how can 250,000 people hog tie 8 billion, keep you in fear, okay, mess up your mitochondria, calcify your mitochondria, cause all this inflammation? There is only one illness, and it is what? Inflammation that causes crystallization, calcification, scar tissue formation, and then when you have so much inflammation, your body goes into overproduction of mucus, and then you drown your lungs with mucus. Do you understand? Okay.
Because the body makes mucus to get rid of the toxins. It's trying to push it all out. But if you never...
Well, you need it smooth. You need it smooth. You know, your digestive tract is 33 feet long, and things need to slide out, baby. They don't need to be sticky. You know, it's like, you know, understand that drinking structured water, warm to hot, and drinking a gallon a day is the way. Whatever you weigh, write this down. 3/4 of an ounce for every pound. That's what you need of structured water. And if you did that, you would double your energy in one day. Double your energy. This 8 ounces of water thing, who made that up? Who made that up? Now with the blue light and the EMF, do you know how you need way more water? And structured water is the only water that, guess what? That pulls EMF out of the body. Did you get that? Is the only water that does it. Okay? All right, so let's talk about it. Go ahead, love. Please keep your tags on so everybody gets to know your names.
I'm Sue.
I know that. I know your name, but I just keep your tags on, okay?
Yes, I've got sticky SI joints.
Okay, sticky SI joints. So understand something. Is that okay? All right. So let's just talk about the SI joints. Okay. So what we would do is when we're done here, I will feel your SI joints. We'll do it when we come off. Now, most SI joints, when people have a problem, they feel this big. That is calcification and scar tissue formation. When we get done, they're no bigger than this. Look at this. That's it. You'll see it. And I'll prove it. So what we would do, if we went in there and it felt like fibrosy, like a rope, and you could feel that it wasn't too tight and too dehydrated, okay, we would do less pulses. So the more calcium that's in there, the more pulses we got to do. Now, I used to have the feeling to do it after, but it's always better to do it before. Everybody should have their cell-sonic treatment before their non-surgical. Now, if you do, let's say, anywhere like 8, 9, and 10, that's the highest, right, pulse. That's when you're going in to awaken things. You're going in to bring life to the tissue so you can work on it easier. And you're going in to fracture the calcium particles and loosen them up that are caught within the hip, the SI or neck, doesn't matter where in the body. So what I would say, can you come over here and I can just feel a little bit? I'll be able to tell really fast because I've done it for so long. So come turn around. Okay. Oh yeah. Okay, wow. Okay, you feel this? Okay, so she actually has I want you to come here, and I want you to turn around, and you're gonna feel this. She actually has, okay, a hard rubber cyst on her SI joint. No.
I
Feel
felt
right
that. I
there.
was just feeling
Feel
it.
that guy.
Yeah.
Feel him.
Oh, I felt it.
Feel it?
I feel it.
She's got a rubber cyst this big. Now, does anybody know why you get a rubber cyst? It feels like rubber? No. Just understand something. We'll talk about parasites in a minute. Okay, all right. Okay. So she needs to have 200 pulses on each SI joint. There you go.
Thank you.
And after we loosen it up, you can have a seat now if you want.
Thank you.
After we loosen it up,
Thank you.
after we loosen it up, then what we could do is you're going to do this. You're going to go in with 10 on her. It's not going to hurt. It doesn't hurt. Okay? And then what you're going to do when you're done is you're going to go back in with her if she wants to spend the money. Okay? We want to do 25 to 50 pulses at number 4. Why? Because when you go in at number 4, it will last for 2 days, that energy, and just stay in there helping to heal. And the 10 was to go in and loosen everything up so that we can go in and do 4 treatments in one. Is that true?
Absolutely.
4 treatments in one. So understand something. Everybody watch me in Sydney and in Melbourne of the people with tumors.
Yeah.
And the one lady had a tumor about this big. Understand something. Those are called fake tumors. She was told by the doctor that these were tumors and she needed to cut it out. And did I get rid of it in 10 minutes? So understand, somebody says to me, oh, you're a fake. That wasn't a tumor. I know, I didn't say it was. She told us it was a tumor. I said it was scar tissue and calcification and inflammation. I never called it a tumor, a fibroid or a tumor. You know, and they used to call tumors that were activated stage 4 tumors. And then anything below stage 4 was called a fibroid. Does anybody notice that 15 years ago, they got rid of the word fibroid and they call them all tumors, and now everybody's getting the living crap scared out of them. Did you get that? Doctors are being manipulated. Doctors are human beings. They are good people. Nurses are good people. Everybody out there that's doing their work are good people. I'm not telling you that I'm smarter than anyone else. I just want to know why things aren't working. And when things aren't working, I stop doing them. I don't just do them. I'm going to stop doing them. That's it. So, anyways, do you have anything you want to say about that? But I will tell you, sweetie, that if you don't get that core is your problem. You know that rubber cyst you have? Guess what? You will find on everyone that is bloated, overweight, and no tone left in their abdomen area, you'll find a band this thick, and it'll stretch their whole low back, and it feels like a rubber mat. Because it said, listen, you are either going to tear right out and become crippled, or we have to build a rubber mat here just to hold you up. Because remember, everybody, you don't pick things up. Your grandchildren, groceries, you don't go and do anything. It's all core. It's all core. Do you know why you fall and lose balance? Because you have no core. And when you have no core, your bacteria are on the floor. So you should have 85% good bacteria, 15% bad bacteria. And guess what? Whether you believe this or not, it doesn't matter. 98% of the population has 85% bad bacteria and 15% good now.
And if you consistently are on the black gold and the black diamond, you will feed your bacteria and completely.
I don't believe in
them.
taking bacteria.
No, you
They're
want,
aliens. It's mummy's bacteria, guys.
you want the food for your good guys that are already in there, that have had their numbers just brought down so low that they're not able to do the communicating that they're meant to do to keep you healthy, because your body's designed to filter and deal with stuff. The problem is our filters are full and we haven't taken any time to clean them. We'll take our car in for an oil change. We'll do the transmission fluid. We'll change those fluids. But will we look after the filter of our own body, which is the liver and the health of our large intestine? It's pretty simple.
I had a doctor come on and one of my shows and say that you know, that I was fraudulent because Doc of Detox, the body doesn't need the detox. He's absolutely right. I am a fraud. And I'll tell you why. Because your lungs are a detox, your skin is a detox, your colon is a detox, your kidneys are a detox, your liver's a detox. There's hardly anything left that isn't a detox. And guess what? I will be a fraud as soon as they stop poisoning us. Water, food, mind, come on. Our body can't handle it. If we lived in an organic world, we don't need anyone.
We wouldn't have the symptoms.
You know what? If we lived in an organic world, I'm out of business and the emergency doctors would be in business. Because guess what? We would need emergency care for sports injuries and accidents. Do you understand? So I'd be out of business. Just give back the planet.
When you say good bacteria, do you mean gut flora and enzymes?
No, gut flora is the only thing, not enzymes.
It's the microbiome.
Okay, their microbiome is only your bacteria. Now, how many people know this? Ready for this? You want to know this one. What was the main thing that was altered in everybody who ever got one of these? It destroyed your lactobacillus. And when you destroy the lactobacillus, you destroy the brain of the human body. How many people know that the brain is not a brain? It's only a computer. It only runs programs. And it only is a chemist that dumps hormones and chemicals, and it'll dump it depending on your mood. It'll dump the hack if you're in a bad mood, and most people are in a bad mood, and that's why you have bad health.
Well, and we're supposed to have 22,000 species of good bacteria in our gut, and your average person has 7 to 15 species that are actually healthy. When you have those 22,000 species healthy and you have that biodiversity, you have an immune system. So why is autoimmune diseases so rampant? Because everybody's gut has been...
You're attacking yourself.
Yeah.
You're attacking yourself mentally and physically and emotionally. And look at the stuff you call food that's in your cupboard right now.
It's like sending nuclear bombs into your microbiome.
But look at all the people that want to be healthy, and look at some of the shapes that some of the people are in that are in this course, because they've said, I've had enough. And most of you are eating better than your families, but it's not good enough, is it? Okay.
But there's hope.
There's more than hope. Hope don't float.
This is true.
Okay? All right? The faith needs to be in yourself, your own healing. And until you honor, love, and respect yourself before anyone else or anything else, you're going to compromise what you eat, drink, and think. Yes or no?
Okay, I've got a few areas I've looked in for. One of them is I've got a cataract. When I collapse, I'm actually tired.
Okay, first of all, if I can say this, we're going to get a little bit off course, a little. But if you've got a cataract, where's your Teslas?
I've got them.
Do you need to wear them all the time, 24/7, love?
Okay.
Wear the Teslas, because the Tesla glasses will actually stop any progression of it. And are you putting the, you should be putting 1 drop of the iodine in 3 times a day in both eyes. You treat both eyes. You don't treat one eye with the problem. You treat them both the same, okay? And she should be doing the bright eyes, and she should be doing that 6 to 8 times a day.
I do it, but not that many.
No, I know, everybody looks at
The label.
health. Well, the label, we have to keep it down on the label, yeah.
I was going to say they do.
Yeah, I know. Okay, but everybody looks at health like they do medication. I took 1 pill, and guess what? It was enough to last me for 3 days. No, we're talking about nutrition that will change the vibration, not taking something that will shut off communication. Okay, so all drugs shut off communication. Even though you don't feel the burn, the pain, okay, it's still going on. That's why you take drugs, you still end up going to surgery, because what it did was it told your brain the pain was no longer there, and the pain is still the inflammation. So you're still going to have the dehydration, you're still going to become beef jerky and have mutation, so you're still going to get that chopped out.
Yeah.
Okay, so what we need to do is we need to keep bringing in a higher vibration on a consistent until we create a new program right down to the cells.
Rewrite the cellular memory.
So that's why I'm telling you, you need to do it. And just like I've seen nobody do what I asked. Should be just sitting here and just doing this all day long. All day long. And and you're going to just do it and find out what happens. Because we all know what it means now. We went through it, right? Okay. All right. So when it comes to your cataract for your eye, that's the most important thing. And you never go on a phone. You never go on a computer. You don't go to a movie. You don't watch TV unless you've got those glasses on. Because those glasses will not just, they're not blue blockers. Our Tesla eyewear, they turn every negative frequency into a positive. How many people know that the 5G or any EMF that hits your eyes, I always have these on. That's why they hang here. But when I'm on here, people, they go, oh, there's the movie star. Okay, so anyways, so the reality is this, is that even 5G, 4G, 10G, because we have 10G in the cities now. You guys didn't know that, right? Okay, so when that hits your eyes, it matters. It actually turns it into healing rays. It doesn't block it. It changes everything. And guess what? Does everybody understand that why do you have a cataract?
Brain burn.
No, don't tell her. Don't tell her.
It's interesting because I only have it on one eye, so there's something different about one eye and the other eye. So, yeah, I know you say your brain's on fire. Yeah. And can you stop wiggling your legs? Because that's really important. If she even stops that, she'll stop the cataract from growing. The cataract's growing because when you're continually moving your legs like this, you're dumping adrenaline. It's not bothering me, but guess what? Everybody do that for a second. Come on. How does that make you feel? Feels like you got to get going, right? Feels like the car's running. Well, she's doing it. She's got both legs going. So she's got a couple cars running. Okay. All right. We need to stop it. So what I want you to do, if you're a friend of hers, is just come up and just touch her leg. That's all. Just touch her leg. Don't say it out loud. Touch her leg. And if we do that enough times during this course, she'll stop and she's going to tell you, wow, I have more energy. Well, there's another miracle. Okay, so the cataract is actually caused because you have brain damage. And if you don't wear those glasses, you'll have more brain damage. And when they created these phones, they could have put scalar energy, Tesla energy, Rife energy in all of these phones coming off. And what they do? They put blue light, which is 12 o'clock light, which means that if you look at that at 8 o'clock at night, it says you're not going to bed for 8 hours. And does anybody know, how long is it 12 o'clock?
60 seconds.
60 seconds. After 3 minutes of being on a phone or a computer, you're causing brain damage. So understand, do you think that's hurting anybody's relationship with themselves, their family, and their loved ones? Do you think the exhaustion, the headaches, the depression, okay, they can't understand what's wrong with them, which is from A to Z symptoms? Okay, so as far as that goes, so what they're going to do is they're going to work above.
Yep.
Okay, so they're going to do 20 above. They're going to do 20 to the side. And they can do 20 here, but when they come here, you're going to have water in your mouth. You're going to fill your mouth up with water. Okay? All right? And trust me, it's going to affect it. We never ever, Cellsonics never hurt anyone, but we're never going to put it over anyone's eye.
Yeah.
Okay?
Why do you put water in the mouth?
Water in the mouth? Because we wouldn't want to crack your teeth.
The frequency.
And it won't crack your teeth. And it probably wouldn't crack your teeth. But what if you had really bad teeth? So we always are going to be safe about everything. And she's right. If we were to actually, if we do non-surgical, back here, these are called the upper, you want to explain it?
It's the occipital eyes, so it's mirrored from here. And if you have issues with your eyes, you will have knobbier occipital eyes than if you don't have
Put your hands back here, guys. Do you feel that right back here where your occiput is? If you come down and you'll feel there's a ledge, okay, and then come a little higher. Now come to the sides. You feel those horns?
You shouldn't have horns.
You shouldn't have horns.
You shouldn't have
Okay,
horns.
now if we go in and work on your occiput and do the non-surgical in here, guess what? You're going to see clear. You're going to go, oh my God, my eyes, you never touch my eyes. Why do I look clearer? Well, because your axis and atlas are supposed to move, And also, if we do the middle eye, which is the brainstem area, we're going to increase your blood flow and your spinal fluid flow by 30%. How many people know that we do not lose bone calcium and become shorter?
We lose hydration.
You lose hydration from, you explain that, would you?
We lose hydration in the cartilage, and it appears that we lose...
Your discs.
Yeah.
You know, your cartilage discs, the discs in between the vertebrae, they go all the way up, right? In between each one.
When they're juicy, you have height.
They're spongy when you're young, and then, guess what? Because you were pooping in your pelvis.
And a stress monkey.
Yeah. And the reality is now they become like beef jerky. So the flow, because your spinal fluid, it works like a zipper at the fair. Remember the zipper ride? So the spinal fluid goes up with the information to the brain and tells, I want this chemical, these hormones, go here, go there, go here. So that's continually going like this. But when you get dehydration in there, it doesn't flow properly. And how many people know, where's the main part of the body that gets the surgery? L3, L4, L5. What sits right in front? Your transverse colon. You've been pooping in your pelvis, girl. That's it.
That being said, the Salsonic works if you have teeth issues going on and
Yeah.
you hold the water and have it in there, because I experienced that personally, and my daughter, even just before I left, she had a toothache and they wanted to put her on antibiotics for it. She did Jason and Melissa's Salsonic, and she hasn't complained about her tooth once, and I think she had 150 pulses total on there with water in her mouth, and it's amazing.
Yeah. So that's what we would do. What's the next thing, Fiona?
Feet.
Feet?
Very bad plantar fasciitis, a lot of pain.
Okay, first thing we're going to do with feet, we got to do what we call the horseshoe. Can you tell them what that is?
The horseshoe
You want to
is...
bring your foot up nice and high?
The horseshoe is at the talus. It's right across here, the main joint there.
Yeah, and
And
guess
you gotta open
what?
up
You'll
the
usually
flow.
find a ball of calcium scar tissue right in here. And guess what?
experienced that.
This is why people fall. And guess what?
It's the
So
stability.
what we want to do is we want to do a half an hour to a 40-minute treatment on the foot. Then we'll use the Salsonic. Okay? Because it will be so much better when we've got flow in there. And when we do it on the foot, we will use the first time only a 4. Got it? And on each foot, we will do anywhere from about, if you got a bad problem like you're saying, 250 on each foot. Okay? All right?
Next, hip. Really, really tight. It's been like that for years.
Again, when it comes to the hip, guess what? We do her SI joint. We're going to do...
And that's the
So
sigmoid side.
what we're going to do is they're going to do the SI joint right here, okay? And we're going to do right in here, the top of the hip, and right in here we're going to find this beef jerky calcification.
Mm-hmm.
So we're going to do here, and we will go into the fossa and release a knot in here, and you're just going to be like,
So Daryl, it's also...
but you need somebody strong to go.
So
What?
it's
No,
your-
it's not. We are, okay, we're going to do those areas, and Alicia, or whoever's working on you, will go in the front. There will be a tight cord, but all that pain you're feeling is coming from your SI and from your hip. Everybody who's got that groinal pain in here, 90% of the time, and then they go, oh my God, there's something wrong with my pelvis, my ovaries, and you know what? But with most women, if we went in and did non-surgical, we'd find 2 little baby fists of scar tissue, and most women also have cysts on their ovaries, and those are pus saccades, and you've got those because of pooping in your pelvis.
I was going to say probably an inflamed sigmoid as well, being on the left side there, which is creating that scar tissue. issue
Which
there.
side is she on?
It's the left.
Left.
Okay, all right. So we've got to go in here, and I guarantee you that we'll see. You see, here's your descending colon. Here's your sigmoid here, and then it goes rectum anus. Guess what's happened to
That
you?
corner.
Look at this. It's closed down on itself because the transverse fell down. So now we've got to go and open this up.
So we're going to go in there and we will work that sigmoid area, and we'll go in and we'll work the tendons and ligaments in here. But those are not the problem. Just letting you know, those are just, it's the same thing. What happens here is a lot of times with women, when they have breast pain, you don't even have to touch the breast. All you got to do is go down and work on the pelvis, because the actual problem is the pelvis. It's like when you go to the fair and you get that hammer and you hit down and that thing goes up and rings the bells. Well, those bells are your
breasts.
Your breasts. Okay, so they understand there's no one that has breast problems without pelvic problems, meaning your ovaries are screaming bloody murder.
Because they're in a toxic waste.
And you can say, you don't know what you're talking about. I've been doing this since I was 23 years old. You do get that, even if I'm as dumb as a stump.
He has to learn something by now.
Yeah, something. Let me tell you something. Let's look for logic. That's all I ask you. Don't look for how long it's been repeated to you. Look for logic. That's all I'm asking.
So how many pulses are you wear?
God, why don't you buy a Sonic? No, I'm kidding. So the reality is, so what you're going to need to do is we'll do the SI joint. So there's should be on that S. Can I feel it? Can I? I just don't want to do more than we need to. Okay, so yeah. Okay, turn around, turn around, turn around. Calcified. Do you want to feel it? Feel it. It's calcified. It's not scar tissue. It's calcium.
Oh, yeah.
Yeah, it's all calcified. So let's just do 200 here. Okay. Let's go just on the hip here and do another 100. Right. Okay. And then come back in here. Let's do the sigmoid area. Let's do 150. Okay. And we could do in the groin area too. All right. Do the groin area too. All right.
While I'm standing up here, do you want to see what I need in my shoulders? Yeah, that's the one. That's.
Okay, what's going on with your shoulders?
So whenever I do exercise, like if I swim, I always pull something. If I pulled up a pot plant the other day, I ripped it and it's hurt for 6 weeks in pain.
Can I ask you a question?
Yeah.
What was your addictions?
Tea.
What else?
I don't know.
Black tea?
Yeah, with milk and honey, yeah.
I hope you know that if you drink tea all the time, you can kiss your kidneys goodbye. Okay, especially black tea. If you're drinking organic herbal tea, if you're buying herbal tea and it's not organic and you don't structure the water, you can kiss your butt goodbye again. It's so poisoned. So,
and I used to have a lot of fruit juice when I was like for the first probably 40 years of my life.
yeah, the fruit juice, nobody should be drinking. You don't drink, Diet Pop, see?
No, don't do that anymore.
I know, but you did.
Yeah.
Okay. So Diet Pop, its main job is to actually create pinholes in the brain. Okay? All right. So just so you know, you might want to think about this one. In the United States, okay? In the United States, this is just beyond. In the United States, every year, Coca-Cola, you know how many people are on food stamps? 15% of the population of the United States is on food stamps. And I heard it just went up to 25% since COVID was on. So understand, in the United States, Coca-Cola said that it is, racial discrimination not to give people who are getting food stamps Coca-Cola, because everyone who has money does. Coca-Cola, you bastards. Coca-Cola gets $4 billion for food stamp money, from the government every year.
Not to mention when you drink diet soda, your liver can't actually tell the difference from if it was processing alcohol. And it's creating excitotoxins.
It's liquid diabetes, guys.
And it's killing brain cells.
It's liquid diabetes. That's all I'm going to say.
Yep.
Yeah, and understand something. The zero means that a zero is a hole, and the trick is that you're getting holes in your intestines and your brain. It's to create leaky gut and leaky brain. Yes, and we are the smartest species in the universe. Okay.
It also contributes to fatty liver, but
So
that's
just so you know that, if you don't believe me, go check it out. They get $4 billion a year. And in the United States, for every person in government, there's 4 people that are there by corporations getting what they want. 4 to 1. Anyways, enough of that. All right? It's going to crumble someday. Well, people are first, though. What else, love?
Just as how many do I need? Is it? Can you pulse on the shoulders?
Oh my gosh, yeah.
Yeah.
You can. And with the shoulders, you would actually do the pulses before. Okay? And we'll see how much, if you went in there and you go in and there's a ton of beef jerky, a ton of scar tissue, and her bicipital groove is totally frozen, and she's got a calcium nodule back here, then I would tell you to do it before and after. And if you're doing it the first time, just do 150 here, just right here, on the cuff and right down to here. That's all you need. And on both of them. And then if she's just loaded with it and she wants to do it, okay, do anywhere in between, again, 25, do about, I'd say maybe 30 pulses at 4 when you're done. But always go, when you go before, you're going higher. Why? Because we're going in to reactivate all the cells in the scar tissue. Understand, does everybody get this? When we work on you, we are not getting rid of scar tissue. We are bringing your life force back into the tissues. Did you get that? Where does all the scar tissue go, Dr. Wolf? Remember that woman? Did you see how big that knot was? It was that big on her neck. Where did it go? If it was actual real, if all I did was bring the energy and the flow. Remember, I worked under here, got her lymph moving underneath, right? Okay. I went in, and guess what? What happened? I showed you. I worked on her TMJ, the anger issues, worked around the ear, and I worked underneath the jaw on the lymph. Never even touched it, and it was gone by 50%. Were you there? Yes or no? Am I making this up?
Yeah.
Never touched it. It's all about flow.
It's activating your body's own regenerative process. It's just an assistant to do it by restructuring the tissue and opening up, breaking up the beaver dams that have totally cut off the blood flow, the energy flow.
We're not trying to make enemies, guys, but let me tell you. For 25 years, I've been offering a money-back guarantee you're not going to surgery. And that's not because I'm against the surgeons. Surgeons know surgery. They don't know about the spirit. They don't know about the light. They don't know about electrical energy. They don't know that it's even scar tissue that used to be connective tissue that can be back to connective tissue. They don't know any of these things. I am not at war with anyone. But I'm telling you, you don't go back to surgery. Surgery should be your last option. And it should only be your first option if it's a life-threatening situation. And then thank God for surgery. That's it. Anything else?
My only other question is these little calcifications, and they hurt from time to time.
So what I would need you to do is I'd want to pulse these things at least right on here, not even move it. I want 25 pulses on each. They're hard as rock. And guess what? We could even do that just for fun and pulsate these 25, 25. And guess what? I'll have them gone in 10 minutes.
Great.
What? No, ganglion cyst is scar tissue.
Yeah, that's
Oh, isn't that a nice
that's
name?
hard.
Ganglion cyst. You know? No, but I'm mocking him. Wherever you find something, you give it a separate name so it can get a separate drug, so it can get a separate therapist, so it can get beyond Thunderdome. You can't figure it out. Remember something, you're all too stupid to heal yourself. Remember something, we are not against the medical system, we're against what's behind it.
The pill for every ill.
Is that it? You sure? You sure? Is there anything left? I think we should maybe just turn it on. All right. What?
On 10, what level? Was it a 10?
On the hip?
Yeah.
Of course it's a 10. And remember something, can I say something? If you went in there and you did that and it didn't fall apart like it, you know how if everything falls apart usually, but if it doesn't fall apart and it's really fighting back, does anybody know why it doesn't fall apart? Sure, if something's older, more dehydrated, it might be a little bit harder because you're unwilling to let go of the issue that you put in your tissue. You might want to just fall in love with life real fast here. You might just want to do that. You might just want to get excited about being with you. Have you been doing the mirror work?
Occasionally.
That's right, occasionally. Let me tell you something. She doesn't stick to anything. And guess what? Take a look at the people. I don't say anything. And the people that have more love bands on their hand except one, they're the most messed up here. I got to put 5. It'll get there quicker. She's got 3. Get 2 off now. That's a distraction. 1 band. And you don't have another thing on your wrist. Not a watch, nothing else. Please just trust me. I don't want you to follow me. I want you to lead yourself to greatness. Do you understand that? I'm trying to tell you what I've learned that works over 40 years. I'm not trying to tell you what to do. I just want you to fall in love with you. Yeah, if I put 20 bands on here, just fit.
I use them for my hair.
I told you if you want to do it fast enough, you should be sitting here doing this. That's all you needed to do. Just lightly do it. Just rest your hand where it's comfortable and just do this. And you might as well, guess what? Why don't you just do this? Oh my God, what are you, a moron? Well, I don't know. We're doing a lot of moronic things lately, so why don't we just do this? Okay. Who's next? Come on up and talk loud enough so we can know. Yeah.
So I have some significant trauma bumps. And when I was in Calgary about 10 days ago, 10 days ago, Jason did 150 on each side.
Yep.
And 100 up the center.
Did he do non-surgical?
Then he did non-surgical. So I got the left side done, and then I went back the next day. And
So 150 on each side and then non-surgical. So that was exactly right. Okay? He did it exactly right.
Okay. And then I went back the next day, and he did the right side non-surgical and did my TMJ.
So he only did the left side?
No, he did. On Thursday I went there, he did the cell sonic on both sides, and he did the non-surgical on the left side. And we ran out of time.
Okay, that's why. Well, you need to say that, because I want to understand the logic here.
Okay, so we ran out of time, so I went back Friday.
Ran out of time, okay.
Went back Friday.
So he did non-surgical on both sides, 150. He just did the one side, ran out of time. Went back and then he did the other side.
No. So on Thursday evening, afternoon, whatever, he did all the cell sonic.
Okay, I got it.
Okay. Did non-surgical Thursday, ran out of time, did non-surgical Friday.
That's right, good, okay.
And then...
How long ago was that?
A week or 10 days ago.
So guess what? If she gets it now, guess what? It's coming down. So remember, if you do an area with non-surgical and cell sonic 3 times, at least 95% of everybody with any problem, it's a new program. Okay, does everybody get this? That every food, every drink, every human being has a different frequency? Do you understand that if you bring in things that are higher frequency, that you're actually creating a different program in your cells? Would everybody please go do your homework and find out? The study has been duplicated over 50 times, that if you put a certain frequency into a cell, you can turn cancer on. If you put a certain frequency in a cell, you can turn cancer off, which is stage 4 inflammation. I didn't make that up. Go check it out, please.
Your thoughts are frequency.
So if we go in on a weekly basis with a situation like that at least 3 times, it might be up to 5, because guess what? How much are you willing to not change? Some people are so stubborn, you know? And when I said today, hey, could everybody smile for the whole course? And some people looked at me like, piss off, okay? I got nothing to smile for.
So that person's going to take more work, aren't they?
Well, your thoughts put out frequencies, so they are structuring your cells. So you can do the work, but if you're not doing the work here as well, you're going to be taking steps backwards. Your thoughts matter. Your emotional state matters because it's energy in motion.
So we got into the jaw on this side and into the neck, but I also have something going on right here in my shoulder because if I reach for something quite quickly, it catches me right there. Kind of runs.
So it's in the shoulder, it's in the back. Okay, well, first thing is there's too much. What we need to do is do the non-surgical. We want to bring it down, right? You know, you're going to be here for a bit, right? So we can do non-surgical on the main areas, but and cell-sonic, but other areas, let's not do cell-sonic everywhere.
Right.
Because that's not what it's all about, okay? I mean, if you had a cell-sonic, had your own pulse head, go to town. That's what I do. But the reality is that let's not go to town. Let's be logical. So in the course, I'll work on you.
Okay.
Give me your hardest thing to do. And then I'll whip that sucker around. That's it. I'm serious. So we'll do that. But I would suggest that you get the non-surgical done again on the occiput. So that the three eyes, the outer area and the middle eye being the brainstem area. And then get the non-surgical prior, okay? And then depending how tough it is, if it's not that tough, then don't do it after. But if it is, then go to a 4. I like that idea when we've got a real tough area that we go in with a 4 so we have longer lasting energy. Because when we go in with a 9 or a 10, it's to go in there and just, hello, okay? And then to break things up, and it breaks things up and gets things going so we can go in and do an incredible job. And then putting in the 4 gives a different type of frequency of over the next 3 to 4 days healing. That's how long the energy stays on a 4. You got it? Okay. And then we only work to, people will come in and say, listen, I want you to do what's going to work. And then people go, how much does this cost? I only have this much. We work with their parameters. And then we're going to let them know. You do know if we do this, we'll get this, and we're still going to get more results with the non-surgical, even if we don't do the cell-sonic than any other body work, I promise. But people say, look, I'd like to see you bring it home. So we'll bring it home. What else?
So in 2018, I was diagnosed with some DDD, L456, I think it is, some bone spurs.
Bone spurs. There's no such thing as bone spurs. There's calcium deposits that are being dropped in areas that she's totally inflamed with. So somebody's, where, L3, L4, L5 area?
Yeah, something there. 4,
Yeah,
5, 6.
so somebody's had bowel problems since she was a baby. And you've never looked after it properly. So you also hang on to a lot of shit. So who are you pissed off with all your life?
The whole fucking world.
Really? So you've got to leave the world alone. You've got, the world's not going to, the world, okay, don't say the world. Say the systems. Do you love the world?
Yeah, I do.
The world is a planet. The world's a planet, guys. At least vent it on the right place and then get over it. The world is never, save the world. Save the world? Are you kidding? Human beings will be dead before the world even has a fart. You guys are crazy. And then guess what? You're also full of guilt. You're home recycling. Meanwhile, it was the Rockefellers that pulled all the glass off and made everything into plastic and then dreamed up recycling and then put a guilt on us. And because we're guilty, because we're trying to buy our vegetables that they wrap in plastic. How psycho is this? Stop being angry. You have the best day of your life. Do you want to get back at these guys? Then have the best day of your life.
Love your life.
And love your life. And say, what would I do and how would I act and who would I be to have the best day of my life? Hey, listen, you don't have the world attacking you. I do. Right now. I do. You don't even know half of it. But I'm not stopping. Because I know that if I can get enough people to buy into my BS, my belief systems, that guess what? Unconditional love and care for yourself.
I'm on that path, but there's still still all that lingering in my body.
Well, because guess what? You were always a little rebel,
Yeah.
and you thought that there was something to fight for. The only thing to fight for is loving and caring for yourself, because guess what? If we all loved and cared for ourselves, what kind of decisions would we make? We wouldn't be buying alcohol. We wouldn't be buying their drugs. We wouldn't be vaping. Okay? We wouldn't be buying any garbage foods, would we? Unconditional love for yourself. You'll drive 40 minutes for a good salad. I do it. And guess what? And if I can't eat something good, then I'm going to drink water. I'm going to be grateful for everything that I've been given. But tomorrow I'm going to wake up and demand more. Because you cannot ever think that you are going to have what you deserve unless you demand it. And that's the deal. So who am I pissing off? Well, almost everyone. And I don't care anymore, because I'm going to do it the way I'm going to do it until I decide I don't want to do it anymore. And then there's going to be other people that are going to do it. And if I can get enough people loving and caring for themselves and being able to stand in their power no matter how many people come up against them. Because the majority is dying in front of our eyes. Yes or no?
Yes.
Do you want the stats? I don't want to go through them right now. The stats from 3 years ago and now, some of them are up 3,000%. So go ahead. The whole world can find something to hate if they want about me. Or they could find something to love about themselves and their life and just focus on that. Just focus on yourself. Mind your own business. Find your authentic self. Lead yourself to greatness. And that was for you. That was for you. So where's all your anger got you?
In a heap of pain.
A heap of pain. And guess what? Does anybody care that you're in pain?
No.
No. They're going, please, go get some drugs and shut the hell up. Because I don't know what to do with you. Is that true? And then you feel rejected by the world. That makes you more angry. You are so going to rock this. You know, everybody, where are you from again?
British Columbia, Canada.
Where?
Okanagan.
Where?
Well, exactly Oliver.
Oliver. So she lives only
1 hour.
1 hour from our clinic in Kelowna. And she flew all the way here to take this course. So do you think that she's going to hold on to it? No. Nobody climbs a mountain, swims an ocean, okay? So you're already there.
I'm here to finish stepping into my power.
You are. And stepping in your power is stepping into unconditional love for yourself, okay? And being the leader of yourself for the rest of your life, and no one else leads you.
Amen.
Amen. All right. Next.
One last thing.
One last thing.
On my left foot, I have something going on here and a nodule on the middle.
Okay, first thing with the feet, I got to tell you, we do the non-surgical first before the cell-sonic. Unless it's a big calcium, if it's a scar tissue issue, if somebody says, I don't care how much money I spend on the cell-sonic, then I would do it before and after. Do you understand? I would go right on the area of the calcium. The calcium is only going to take like 10 pulses, 5 pulses to 10 pulses. And then the area, depending on how long it is, if it's this long on the bottom of the foot, that would take about 150 pulses. So I'd rather, if a person didn't have the money, I'd rather that we actually did that after we used our elbow to go in and open up because what we're going to do is we're going to find this root scar in there. And it's going to be traveling, okay, long. Okay, and it could have been you damaged your foot and you bruised it really bad, and then you didn't rest it, okay, and then you got this scar tissue. Guys, if I get a physical block, even if it's small, okay, I'm going to say something. Non-surgical will save the world.
We have the most powerful therapy, and I'm not telling you nobody doesn't do anything similar or even better. I haven't seen it yet, but I'm sure there's lots of it out there. I haven't been everywhere. But stuff like this is going to save the world, because this is old age. This is surgery. This is drugs. If you didn't have any scar tissue in you, you wouldn't have any pain, because physical blocks are what cause all pain, all swelling, all stiffness, all inflammation. You do get that. And the reality is this. Once, I know that you're all like, we get to the point where it's like, oh my God, okay, I'll take the damn course, I'll spend the money. And now just fix me now. Because you know what, you take it right to the edge, don't you? Everybody that comes here is almost on the bloody edge, emotionally and physically. And guess what? All I can tell you is by the time you're done the non-surgical course, you're like, what a joke. It was only a scar tissue displaced calcium issue, and we've learned everything. And understand something. And so then we'll have people that have gone to school for 4 years, 6 years, and guess what? They don't even have this information, do they? And you know, I'm right. Go to a naturopathic doctor, talk to him about this information. After you finish this course, and he'll be, what? What? What do you mean? What? I don't understand. What? I'm not saying all of them, but most of them. Just understand, you'll have the power and you'll have no pain when you're done this course. Are you going to do the pelvic squats every morning and every night? Are you going to do the crab stretches? Are you going to do the mirror work?
Yes, I don't know about the crab stretch, so I have to learn that.
That's tomorrow.
Okay.
Okay? Don't get crabby.
I'm a counselor.
Oh my God. Little crab. Okay, next. Do you want to come closer? Because everybody, until you find your voice, you're all going to go, well, I have this problem. I have this problem. Do you understand that if you don't speak up, you're not going to get what you need? Samantha.
Yes, hi.
Hi, bud.
I have started for the easy things. I have
Easy things. Are we doing a whole laundry list here?
I have
Let me tell you something, just so you know this. By the time the whole life coach course is over, I'll tell you that 70% of your pain is gone. Maybe 80%. You have to understand, the emotional caused a lot of physical damage. Even if you go in and you change everything about yourself, you do know that beef jerky doesn't leave. You'd have to do so many fastings to get rid of it. That's why, did you ever, people go, I've done so much work on myself, but I'm still crippled. Well, that's because it's beef jerky. But most of your stuff is because you dishonor yourself all the time. Well, it's true.
So I'm here to learn.
And I love you.
Thank you.
And no, you don't say, you say, I love me too. Say that.
I love me too.
And nobody's allowed to say thank you to me. You say thanks to me. When we do a BraveHeart circle, you go thanks to me. You are not going anywhere unless you thank you. You are not going to instill this stuff and go home with it unless you thank you. Anybody thanks me, they have to go out and knock on the door. And then we'll say, who's there? And you'll go BraveHeart. And it's not to punish you. From now on, you're going to recycle everything back into you, because it's all up to you, baby. It's all up to you. It's not up to me. Listen, I am going to be giving you information, and you better be taking all the credit for it. When you take this course, no matter what it's done for you, I don't care if you tell another soul. Don't. Keep all your energy. Fuel it back into yourself and become that great wonder that you've always wanted to be. Oh, if it wasn't for No. What did you do? Well, I just unleashed the amazing in myself. Where'd you go? I just went away and just went to Australia and found myself. That's it. No more than that. Did you hear me? I meant it. Nobody gets the credit except you. Nobody can heal you but you. You get that, Samantha?
Yes,
Daryl. Dr. Wolf is flypaper. Daryl. There you go.
Like the other lady, I have stiff and sore feet and stiff ankles.
Yeah, but I know, but you're going to have stiff, sore feet because of lactic acid crystallization in your feet. And when you are exhausted from yourself, your feet are killing you.
And I get pain from here just around.
Oh, that's a piece of cake. Oh, so what we'll do tomorrow, just for fun, I'll get rid of that in 7 minutes, 8 minutes. How's that? And you're going to go, oh. Guys, do you want to live with pain all your life, or do you just want us to get rid of it? Listen, pain is a GPS. It's a God-given gift. And because you did not listen to the messages your body gave you, we have to go and get all the accumulation, because every time that you felt pain and didn't know what to do for yourself, you stored it. That's not my fault. It's her fault.
And I have fibroids in both breasts.
That's, okay, first of all, if you want, we can let all the women feel your breasts, and then we'll work on your breasts. I was just kidding. Just 20 of them. Okay, but we can have, because we want to prove it to you, that we'll get your worst fibroids, okay, and we'll work on you for 15 minutes, right? And then if we reduce those by 60-80%, is that fast enough for you? But then they're going to come back, okay, if you're disowning yourself on that level. And if you go into your guide and you go watch the emotional chemistry of cancer, disease, and healing, you'll find out why you've got the fibroids.
Do some research then.
Yeah, why not, for the heck of it. But the fibroids are a piece of cake.
Yeah, I have a hiatus hernia.
Yeah, okay, so within the next 3 days, we'll fix that in 10 minutes. Is that okay?
Okay, but the complicated thing is...
Complicated.
I've had blood clots in my lungs.
Okay, so now what we need to do is we need to do, okay? We need to do non-surgical in between the ribs. Because believe it or not, guess what? When you do non-surgical in between the ribs, does anybody know that you increase the lung capacity by 30 to 40%? Is that right, Lisa?
Oh, absolutely.
30 to
I
40%.
felt that.
Then we're going to do cell sonic on them. But do you own a nebulizer?
Yes.
So now you're going to buy one of the plug-in ones, because they're the better ones at home. You take the travel one with you, and you can do it right on the plane. And you're going to nebulize like you're addicted to it, with the iodine, the infinite iodine, and with the bright ice, and with the silver bullet liquid. You're going to nebulize like you're addicted. And if you did that, guess what? You'll totally revitalize your lungs if you do the non-surgical and then do the cell sonic on here. And this is going to take, for the cell sonic, it would take about 150. Okay? And it might take up to 250, but you won't need it again. And understand, most people that have problems with their lungs have problem with their breathing. And that means you've been terrorizing yourself. Okay? Because if you think that a tiger's chasing you, how do you breathe? Very shallow.
And up high.
And yeah, up high. And that's it. You don't use this. So it locks down after a while because an elephant's sitting on your chest. Understand something. Let me tell you, I've got children that are adults, okay, that think the paper tiger has teeth and that he's still chasing them. And they'll be on the phone, Dad, and I'll be going, hi, how are you? We'll talk tomorrow. And they know what I'm talking about. Because I'm not going to go, do you think you can connect to your breath? Do you think you put a slight smile on? Whatever you're worried about doesn't matter. I've said it too often. I don't want to say it anymore. Just know I love you. We'll talk again tomorrow. And they know what that means.
I have a lot of, last 3 years have been bringing a lot of mucus. And
Yeah, but if you didn't bring on the mucus, you'd be in big trouble. The mucus was trying to actually protect. See, inflammation causes degeneration, and scar tissue to your lungs and alveoli.
The nebulizing will address the mucus.
Oh, it'll be gone, baby.
3 years ago, I used to have parent tissue. I'd be spitting every few minutes. Just this thick, sticky.
I know, but if you weren't making the mucus, you would have probably had some type of life-threatening lung problem.
Stage 4 inflammation.
Yeah, your body said, listen, until she wakes up, then we are going to pour mucus into there to try to coat it and insulate it. And guess what? When you're infectious in here, you're going to be infectious in your lungs. And how many people know your lungs are attached to your bowels? Your bowels are the king, or your bowels are the king organ of everything. You know what? The bowel that they disrespect, the bowel that you disrespect, is 85% of your immune system.
I had salsa.
Does everybody ever notice that when you eat improperly and your bowels aren't moving, you get pretty snotty in the head?
Oh, yeah.
Thank you. There's rocket science. Oh yeah. You snotball, you. Listen, if it wasn't for the boogers, you'd be dead. You need those boogers. And when you no longer have the boogers, it's because you don't have an inflammatory diet or an inflammatory personality.
So the mucous membranes no longer need to be inflamed. It just means it's a symptom of toxemia.
I've got mucoidal colitis. Well, of course. The colitis means inflammation of the colon, and mucoidal because it's got to make lots of mucus because now you're eating holes through your large intestine. And would you like to be a screen door in a submarine pooping into your bloodstream and pelvis?
A couple of years ago, I was taken to hospital because I was just bringing up blood. But
Yeah, but blood is all from stress. Yeah, that's you eating away at your tissues.
So it's like,
How does it feel to hate yourself? How does it feel? Nobody can see you. The rest of the people here are all blind. How does it feel to hate yourself, Samantha?
exhausting.
Exhausting. And guess what? Guys, can we find something to hate about her? I mean, seriously, look at this. Look at this beautiful, sweet flower. Are you serious? God. I mean, there are so many other people here that I hate more than you. We use sarcasm and we use this technique to give you a lifetimes of training in one day.
3 years ago,
3 years ago,
I took some medication.
you took some medication.
And 6 days later, I lost my immune system and become like the boy in the
You
boat.
lost your immune system. Yeah, but you have to understand something. Somebody else could have taken that medication and they would have said, wow, it worked. But the reality is that you were so on fire. You were on fire and there was an alarm system going off. And what you said was you had the fire engine coming, you had the police coming, and you had the ambulance coming, and you told them all not to come. And meanwhile, there was a critical situation and you tried to tell them not to come. So guess what? You blew up.
I lost my, because I already had autoimmune disease. I have alopecia. I don't have
No,
hair.
autoimmune disease means attacking oneself on an emotional level until...
It affects the physical.
I lost all my hair. So I already had.
Yeah, but guess what? You know what? You've heard of it before. I'm losing my hair over this. You lost your hair because you stressed your liver out so much with anger. What were you angry over? Now this happened before the hair loss. This is 2 years prior. Okay? Your hair can go gray overnight from shock because you were so acidic that you dumped so much adrenaline and hormones, okay, the wrong ones, that guess what? It needed every mineral in your body, and your hair has color because of minerals. And it took everything to keep you alive. But that was not your case. Your case is that what was the anger issue for so long that you caused your liver to just have autoimmune disease? Yeah, you had fatty liver. You had a fatty liver. You probably have a cirrhosis liver. That can all be turned around. All of it.
3 years ago after taking the medication, then I was fighting for my life because I lost my whole immune system and I couldn't handle any smell, whether it was something good or bad. I could eat any food. All I could do was sip water. I went down to 44 kilos.
Your body no longer trusts you when you can't handle anything. So guess what? She became allergic to life. How does it feel to become allergic to life? Your body no longer trusted you. Do you still have trust issues with yourself? Well, let's see if we can just let them float down the river.
When all that happened, I started just spitting up mucus all the time, and I had a lot of lung issues.
I know, but if you didn't spit up the mucus, you would have drowned in it. You wouldn't be here right now, Samantha.
I still have it now. But
And I know, but the mucus, I know, but she's gonna have the hardest, up in here, that hard, dry booger? Well, she's got those boogers in her lungs. Okay, so now what we need to do is we need to do non-surgical, do cell sonic. We need to clap here every night. Go here tonight and clap this for 20 minutes.
Bring the blood.
Okay, as hard as you can. Okay? And do the crab stretch and open up your ribs. After you do it, do the crab stretch and hold the crab stretch and do the breathing. And tomorrow I'll show you how to do it. But you're going to do the breathing. Are we learning anything yet?
Yeah.
Okay, so we're going to do the crab stretch. You're going to do it for at least 15 minutes. And then tomorrow I'm going to show you every little move. The crab stretch and the pelvic squats are all the exercises you need to stay healthy for the rest of your life. That's for all of you who don't like exercise. But I love exercise. I love swimming. I love doing anything that's physical, right? But I'm just trying to tell you to keep you open. Okay, remember something. When they gave us the toilet, they got our legs to shut like a clam. When we used to squat, you may not like it, but guess who's the smart people? The East Indians that squat and poo and pee. They open up their root chakra. How many times? Well, the women open up their root chakra. How many times? They open up their root chakra 7 to 10 times a day. They squat. That means if ever they get pregnant, they're open and they'll deliver the baby in 20 to 40 minutes. Not like the rest of you that sit on the toilet and are so freaked out that you're all jammed up jelly tight and you've got crystallization, scar tissue formation all around here, and that's why you can't deliver. So now here, don't stop there. Go ahead.
I was going to say, that's why it's like 8 to 40 hours for delivery.
Yeah, guess what? We've got the perfect pain-free pregnancy. What women here are going to be doing this as a living or want to? Okay, quite a few. So just know this. I'm going to be handing you a personal treatment and training for free. And it's called the Pain-Free Pregnancy. It's a 12-day training you're going to do for couples. It'll blow their mind. We've been working on it for how long? I've been working on it for 5 years.
I just joined.
Yeah, and it's going to be wrapped up, okay? It's going to be all wrapped up in a bow in 6 weeks, finished, and I'm going to hand it to you as a gift. You know how much money I've spent on this? You have no idea. And the reality is this is going to change things. You could just do this for a living. Okay.
Bring beautiful birth back in.
Yeah, and understand something. So they don't stop there, guys. So now they give us the toilet. Oh, isn't that cool? And then they give us bleached toilet paper that has 2 cancer-causing chemicals in it. Every time you wipe your bum, and your anus has more nerve endings, and it's the thinnest tissue in the body, and you absorb all that cancer-causing chemical. And how many people know that bowel cancer is on the rise faster than any other cancer? So you go ahead and keep on wiping that butt. I'll tell you right now, wherever I live, it'll be a bidet, and that's it. I'll have a bidet. There'll be no toilet paper, okay? All right? And I will have it built that I will squat on top of my toilet.
And if you were eating a perfect day, you wouldn't have that stickiness that requires the balls.
A glicky, sticky diet gives you this. And then you got to wipe and wipe and wipe. Yes, Michelle.
Do you know that everyone over the age of 50 gets a free bowel screening for cat stage 4 information? And I'm 57, and my daughter said, have you done it yet?
Well, understand, you're going to get a free bowel screening over the age of 50 because guess what? Guess what? How many people know that 80% of the population over 50 have diverticuli and don't even know it until they get screened? And now they're going to go in and they're going to give you medication. How many people know that 40% of the people over 50 years old have polyps, which means they're growing mushrooms in their bowel because they've been stagnating, waste, and rotting for that long? So there's a lot of money up there in that gold mine. And the reality is polyps will be gone in 6 weeks on our diet. Okay, diverticuli will be gone in 3 to 6 weeks on our diet and with doing our program. And we don't cure anything. All we're doing is giving you what nature intended to bring you back to balance.
Just to bring balance back to the body, and all it takes is tuning into your conscious awareness and the choices that you have, even if you believe you don't.
Yeah. And I'm going to tell you something too. Who's had cesareans? You want to see us bring the thunder down? I want the ugliest, terrible cesarean. And what we'll do is I will use my cellsonic head. I will do the non-surgical for 20 minutes to a half an hour on that cesarean. And then I will then do the cellsonic. And guess what? That cesarean that looks black, gray, ugly will be pink and the same color as the rest of the skin. And that woman will say, I feel free for the first time in my life. Because you get one cesarean, and what you get is you get 2 to 3 inch feeder roots coming off of it that wrap themselves around your ovaries, your uterus, your bladder, wrap themselves around your intestine. Now you can't digest properly. Making love is improper. Even moving like this feels like somebody tied a knot in you. And if you think you've got problems now, you've got a beaver dam that's in there that's going to cause fibroids and tumors.
As I worked on a lady who had had a cesarean, and she'd had like really painful periods ever since. And we did one pelvic clearance, and now she let out a lot of emotion. But she called me like 3 days later. She's like, I got my period. This is the first time I haven't been in crippling pain. And she's like, it was life-changing.
Listen,
thank you so much.
You're going through menopause? In 4 to 6 weeks, you won't have any menopausal symptoms. If you have painful periods and you're young, in 4 to 6 weeks, no painful symptoms. They're gone.
Clean up your nutrition.
Guys, you were set up. And understand, if anybody lives locally and they want to come for non-surgical and the cellsonic, we're going to be here for a month, aren't we? Okay? All right? Okay. Anything else? Lastly,
just one more.
Listen to me. I want her to understand, and I want you to understand, that we won't have to work on most of these things even before the first whole life coach is over with her. Well, is that true?
Oh, yeah.
Yeah. Yeah. She's got a new attitude.
You find that emotional.
There's a new Samantha in town.
Yeah. Love yourself.
Are you taking the pelvic course?
No.
Are you taking the non-surgical? Where do you live?
The Gold Coast.
The Gold Coast. Would you come back and take the pelvic course?
Yes.
Are you going to come back and take the pelvic course? Don't lie.
If you ask me to, I will.
I'm asking you because
I think it's
okay. Let me just. If you don't think that it was totally worth it, then you'll need to just call, and I'll give you your money back.
You need to take it because it will really strengthen your connection to loving
It's only,
yourself.
guys, it's a 3-day course,
palace.
and guess what? It honors the vaginal canal, which you've dishonored, because guess what? How have you thought about this area here for your life?
Have you thought of it?
Yes.
Probably not.
Non-existent, right?
But your sacred feminine creative energy can be transformed into beautiful healing energy for your whole body. You just need to learn to connect with it.
Talk to me privately. Okay? All right? Thank you.
Thank you.
You're going to rock. You're going to rock. Are you going to use this when you learn this?
Yes.
What are you going to do with it?
I'm going to implement it every day.
For yourself?
For myself.
And what is it you do for a living?
I work part-time for myself.
Part-time for yourself?
Property manager, my husband and I own a business. And
Beautiful. Beautiful. You're going to rock this thing. And Samantha, you have my phone number. Don't disrespect yourself and not use my phone number. And don't ever say, Dr. Wolf, you're so busy. I don't want to bother you. And don't get
Really
on
quick
there.
question.
And if you talk fast, I'll hang up. If you take your time, you're not wasting my time.
Because then you're processing it.
I won't hang up, I was just kidding. But I will tell you to calm it down. Just calm yourself down. Breathe. Get on the phone with me. Whatever it is, we'll work it out. You can call as often as you want. It could be 10 times a day. If I'm busy, you can talk to the staff. Do we turn away any of the calls?
No.
These people don't even have to buy product and they can call us. Understand something though, the more good you do, the more you'll get attacked. Just know that.
And when you wear a smile, that is your best protection.
That's my protection. And minding my own business and love everybody anyway. Just love everybody anyway.
When they come at you, it's a projection of themselves. Because how dare you be happy with yourself?
Yeah, your family, your friends, love them. And you know what? When they see that you love them and you don't react and attack, they're going to go, wow, you are something different. And they're going to love you for that. And eventually, if you want them to change, do you want them to change? Then why don't you change? Isn't that the craziest thing? Oh, I just hate when they say these things about me. No. Expect them.
Mm-hmm.
Expect them and love them and just love them. And don't say, oh, Dr. Wolf said you'd say that. Please don't do that. Don't talk about things you don't want to talk about. Talk about things you want to talk about.
Yeah.
You okay? How you doing? Okay. Okay. Thanks, Samantha. Who's next?
Thank you.
And then, okay?
Three things.
3 things.
Number 1.
I've had 4 seizures.
4 C-sections.
Yes.
So did they cut the same place over and over again?
Yes.
Wow. So there's just beef jerky in there.
Yeah.
Yeah. We should really work
the
on...
first time they sewed it up, they didn't sew it up properly, so my stomach is...
Oh, no. You know what? What we're going to do, I can only work on maybe 4 people during a whole life coach, and you'll be one of them, because I'm going to show you a miracle, just for fun.
That sounds good.
Okay?
Yeah.
All right?
The next thing, I had surgery here,
Yep.
stage 4 inflammation and a neck dissection.
Okay. All right. I need to work on that too. So I'll do that too.
Okay, then I had a...
And you know what, guys? She came all the way from Africa. And I don't know if you know this. You think your dollar's weaker than the American dollar? Why don't you tell them how weak the dollar is? And she had to raise all the money and fly here. And she owes all this money when she goes back. Are you getting it? So what's your story now? What's your story?
And in 2016, I had a car accident, and I broke my coccyx, and I chipped one of the vertebrae, and since then I've had sciatica, and to this day, I can't do aerobics or any...
Sciatica on what side?
It's mostly down the side, but it can be both.
Left side. And it's usually the left side. It's usually the left side. And just know sciatica is caused on the right side because of a cecum blockage, And on the left side, it's a sigmoid blockage. Thank you very much.
Okay, so I'll be very happy because I feel like it's tickled around my back.
The
I'm a
cesarean
tank.
scars won't help with that either. This will be.
No, the cesarean scars will actually wrap themselves around your spine.
So I am going to go home and you will.
You are. Are you here for the whole course?
And the pelvic course.
Oh, God. Oh, please, please,
But if I'm
please.
sitting in the airplane, I'm aware of my back because if I sit too
Yeah.
long, so I would like to have it done quickly.
Well, you can do what I did. You know how small those airplane bathrooms are? Well, people thought I must have had diarrhea or prostate problem or something. Because I would get up every 40 minutes and I'd go in and do my squats in that little bathroom. I would. And I'd just go in there and breathe. But you know how long that trip is? So I'd go for that little walk, do my squats. Yeah. Come on down. What time is it?
It is, yeah,
4:40. How are we doing? I know it's been a longer day, but have we kept you focused?
Learning.
Do you know why? Do you understand why I act like I act? Nobody yawn. Nobody's sleeping. Because guess what? If it's not entertaining, you're not staying. It's very hard to keep somebody's attention this long, and it's also harder to crack their coconut. So you have to be what? Dramatic.
Impactful.
That's it. Okay.
Right. So I've got a very dull pain in my shoulder that has years. It's been years. And I feel like it's related to my own self-worth, and I've been shouldering some of my dad's pain.
What do you do for a living?
I am an occupational health and safety consultant.
Yeah. Did you like the job?
No.
Do you do a lot? Do you do a lot of paperwork?
A lot of paperwork.
Yeah. Anger. So what we'll do is, if you want, I'll do that for you.
Okay.
I'll do it, and it's a piece of cake.
Okay.
So what we'll do is we're going to do the cervical area.
C7.
Okay, we're going to do C7 because that's really the trick. And then I'm going to come under his neck right here. That's the trick. The hook is here, baby. It's right here. Right there. So I'm going to work his TMJ. I'm going to work under here. I'm going to do his C7, not even touch his shoulder, and then ask him how he feels.
Free up the vagus.
And then I'm going to free up the vagus nerve. And then I'm going to go in, and he goes, well, I think I still feel a little bit there. And then we'll find that little knot. We'll go in and we'll unravel it. Is that good enough?
Okay. Yeah.
But you got to remind me, the people that I said I'd work on, you have to remind me.
You got to be on them.
You got to be on me. Because when I come into class, I'm like this. Right?
Yeah. Speak up. Be heard.
And then when I'm working on somebody, we'll have Alicia working on somebody. Emily will be working on somebody else. Okay? All right? Okay?
I feel that I should get my elbow looked after too, if I'm going to be doing non-surgical at some point. I fell in my kitchen last year while I was reorganizing, and I fell on a can of coconut milk.
Fell on a can of coconut milk.
Yeah.
Okay, so with your elbow, we'll understand something. When we go in and do your elbow, I will have to do the elbow. Because you see, he's too beefy. So I'll go in and do the elbow. I'll be using my strength. And guess what? It'll take me one treatment with the Cellsonic, and he's ready to go. And we're going to need to do this sooner than later. Because I've got to go in maybe once now, and then you're going to have to pay somebody else to go in and do it again.
Jason.
Huh? No, while you're here.
Oh, well, I'm here.
If are you doing the non-surgical?
No, I'm not.
Oh, well then don't worry about it.
Okay.
Okay. Yeah, but I'll work on you.
Thank you. Or I should
That's
go
it.
doors.
What?
I should go doors and knock.
Why would you say?
I just said thank you.
No, you don't have to do that. You're supposed to say thank me.
Thank me.
You need to thank yourself for coming to a course that the majority will never come to. You need to thank yourself for coming to a course. I mean, look at how you came all the way from Canada. So thank me.
Thank you.
That's what you say. You're going to say thank me from now on. Thank me. And understand something. You know what you're doing when you say that?
you are honoring 500 trillion bacteria. You're honoring 50 trillion cells. And guess what? Did you know that your body is a community of things that came together to give you life?
Yes.
You think about that tonight before you go to bed. And then you're going to say, thank me. Okay? All right. Awesome. Who's next? Okay, we got 4 more people. 5, 6, 7, 8, 9. Okay, we're going to be doing this, but then guess what? We will stop by 5:30 to do our BraveHeart circle, right? I didn't know we were going to do all this. Okay. All these hands didn't go up at the beginning. I know, I counted them.
My name's on the list.
My name's on.
Something's going on. Okay. All right. So can we do can you do me a favor? Can we take like a 5-minute break? Can we do that? Yeah. 10 minutes. 10 minutes. Let's come back in 10 minutes. And yeah. Thank you. Thank you. Thank you. We'll be back in 10 minutes.